Hello and welcome to Health Club. Winter has set in with all its myriad charms. But in spite of all the charms, we who are suffering from asthma or COPD or various lung problems, we see a flaring up in the winter months. But how to protect ourselves, our lungs and our health? Yes, we are going to discuss all about it in this episode. And I'm very fortunate to have with me today eminent pulmonologist Dr. Raja. Welcome to us.
Thank you.
What I want to ask you first is about asthma.
Sure.
People suffering from asthma have a flare up in these winter months. So I just want to know all about asthma. What is it and what are the symptoms that we'll experience?
Sure. So let's talk about asthma
Yeah.
in the perspective of the winter months.
Yes.
Then we'll be covering both ends, right?
Absolutely.
So asthma is a narrowing of the breathing tubes. The narrowing of the breathing tubes could be due to a trigger. So it could be due to something like a pollen, a dust particle. It could be due to animal dander. It could be due to change of temperature. It could be due to chilly drinks. So that's your trigger. The trigger causes two problems. The first is bronchoconstriction. So bronchoconstriction means narrowing of the breathing tubes. The second component is inflammation. So the lining of the breathing tube becomes narrowed, it's inflamed, red, and edematous or swollen. So when you treat these individuals, there are two things that you address. The first is that you try and bronchodilate the individual. So you try and open the breathing tube up. The other component is to try and reduce the inflammation, which is to try and reduce the swelling, then the redness within the airway. Now something very different happens in our country when the winter months set in.
The
And
pollution increases a
Correct.
lot.
And the reason the pollution increases, I think that is probably going to be interesting for the audience, is something very intriguing called temperature inversion. So what's temperature inversion? So in the summer months, the air that is in contact with the surface of the earth becomes warm. As all of you know, the warm air goes up and this cold air from the top which settles down. And there's this cycle where the air circulates top to bottom. In winter, you have a cold surface of the earth and the air in contact with the earth is actually cold and there's warm air on top. So the air cannot circulate top to bottom like we said before, but it keeps going round and round in circle because there's warm air on top, cold air at the bottom, and the cold air cannot go up like it would do in the summer months.
So it rotates the air.
Correct. So you understand that it picks up the pollutants, the respiratory particulate matter, the PM1, the PM2.5 and the PM10s that we all talk about, and they keep circulating and picking up more pollutants in the process. And hence in doing that, you have a respiratory particulate matter concentration, an AQI, a air quality index, which is far worse in winter as compared to what it is in summer.
So that triggers off.
So that's one cause of the triggering of the asthma. The second cause is the temperature itself. So there's been studies which have been done in India which shows that chilled temperature, that could be cold drinks, that could just be the ambient outside air temperature, actually triggers your asthma because there's more of viral infections during these times. And now that's also a trigger for people's asthma. So that's the connection that you have between the winter months. While the winter is lovely, as you said, we all welcome it with open arms. The temperature is much nicer, but the number of attacks that we get from airways disease, be that asthma or COPD, is far greater in the winter months as compared to what it is during the summers.
Of course. But since the disease increases, of course we have to have the management. How do you have the management?
Sure. So the first step in the management is the diagnosis. So often I have found people coming into my clinic and saying that I have recurrent episodes of cough. They happen in the change of season. I have a runny dripping nose. I have a lot of sneezing. I cannot stop sneezing. But they have never equated these symptoms with that of asthma. Somewhere in the back of their mind, be that because of the fiction they have read, maybe because they've seen asthma in television and movies and so on,
Is it
they
taboo?
feel
It's sort of a taboo on
correct.
that.
There's a taboo about the diagnosis. You're absolutely correct. But along with that, there's also this fact that people feel asthma equates to breathlessness.
Yes.
So it's not always that. If you're getting recurrent bouts of cough, which doesn't seem to go away, if there's allergy in the nose, sneezing, runny nose, blocked nose, etc., all of that complex together could also well be asthma, and they would get breathless, but they would get breathless during attacks or as the disease gradually progresses without appropriate treatment.
So ascertaining the disease is of primary importance.
Correct.
After that comes the management part.
Correct.
With management.
So I think with management, so once you've done those symptoms, the next step would be to do a lung function test, which is called a spirometry. And there are two things that you find in asthma. The first is that the airways become narrowed, and hence you have a drop in lung function, what is called the FEV1. And the second is that the airway becomes twitchy. So if you give asthma medications and repeat a test, you would find the breathing tubes open up, something which is called bronchial hyperreactivity. Okay, so the spirometry gives you the diagnosis. We mentioned the treatment in passing a little while ago. So if we talk about the drug treatment, there are two categories. One is the bronchodilator, which, as you would remember, opens the breathing tube up. And the second is the anti-inflammatory, which reduces the swelling and the redness within the breathing tube. And that mainly is an inhaled steroid, right? So a steroid which goes by the inhalational route.
When you mention the word steroid, that is another taboo we have within us. We are taking steroids, it will be having a lot of side effects. It's not so good. General people will think about it.
Sure.
What are the pros and cons?
Sure. So the taboo is not just about the steroids. The taboo is also about the inhaler itself.
Definitely.
Right?
Definitely.
So again, somewhere in our subconscious,
we think it's addictive
we feel,
or something.
Yeah, so we feel that it's, so medications are to be taken as tablets. So you put it in your mouth, swallow it with water, end of story. If you take something which is inhaled, people feel it's, like you said, addictive, dependence producing, and that I think is equating it subconsciously with something like smoking, for instance.
Absolutely.
Yeah, so people have smoked for years together, the Muni Rishis have, and they've done it for years together. Hence, people feel that if you take something inhaled, you become dependent on it, whereas tablets are medicines and hence do not produce dependence.
We have to have tablets.
Sure.
If we are sick, that's what we
Sure.
think.
So the first taboo about inhalation, I think we would want our audience to remember that if you had a skin problem, you do not take tablets normally. What you do is to apply an ointment.
Absolutely.
That's a twofold advantage. The first is that you're applying the medicine where the disease process is, and hence you're actually using a much smaller dose of the drug to be applied at the disease site. Second, if you take a tablet, the tablet goes to your stomach, gets absorbed from there, goes to the bloodstream, and then a tiny weeny bit of that drug reaches the area which is diseased, right? So you have to take a much larger dose of the drug to have a much smaller effect.
And a longer process also.
And a much longer process, correct. So think of inhalers as being the ointments for the breathing tube. So you're inhaling the drug, the disease is in your breathing tubes, the drug goes to where the breathing tube is and has its action the way the ointment would do for the skin. Hence, I think it's important to understand that inhalers are your main medicines when you're dealing with diseases of the airways, as in asthma and COPD. So that's the first taboo. The second taboo you spoke about was the taboo about inhaled corticosteroids, inhaled steroids. So steroids, tablets taken in the long term do have side effects, right? There are lots of diseases where you have to take oral steroids at reasonably high doses long term, and you incur side effects like thinning of the skin, brittleness of the bones, cataract, hormonal disturbances in the body, and so on. But remember, you're doing that for a reason. If you didn't take the steroid, then the underlying disease process, be that something like rheumatoid arthritis, and there's plenty of other diseases the audiences would know of when they have to take steroids long term.
You have to have it.
Correct. They are life-saving drugs. So the side effects need to be taken care of, but equally the medicine has to be taken, because if you don't, the question of side effects don't arise because the disease probably kills you before that.
The side
Now-
effects of the disease are much more.
Sure, correct. And it's a balance, as you say. So is it a greater evil, or not taking it and suffering from the disease process, which is of greater importance, which has the greater gravity? Now let's go from oral steroids to inhaled steroids, which is what we are talking about in patients with asthma and COPD. So as we said about inhalers, the dose of steroids that you take when you're taking it by the inhaled route is minuscule. It's about 1/50th the dose you would have to take when you take it by the oral route. And hence, the drug acts where it is supposed to. Very little goes into the bloodstream, almost nothing at all. And hence the questions of side effects, the thinning of the skin, the brittleness of the bones, the cataract, the stunting of growth in children, all of these do not really arise because of the doses of the drug are as small as they are.
So inhalers are the safest option.
Absolutely, by far.
So inhalers are definitely a very, very safe option. We have a lot of misconceptions, and this episode has cleared some of them. But if you watch out for our next episode, we are going to talk about COPD, we are going to talk about vaccinations, and we are going to clear about a lot of other misconceptions. So please do keep watching our episodes. And if you definitely like it, subscribe it, and your opinion is of the paramount importance. Take care. Bye. Ciao. Thank you so much.
Thank you.